I'm Dr. Deborah Pan, co-owner of ESANA Plastic Surgery Center and Med Spa and a board-certified plastic surgeon. Today what I'm going to demonstrate for you is how we evaluate a face and determine which injectables might be appropriate for you. One of the first things we first have to determine is what areas of the face are we concerned with. Most of the time I have to tell my patients we have to look at the face in two separate compartments. First of all, we look at the upper half of the face, and if there are any lines or any early signs of aging up here, we usually attribute these lines to repeated muscle action that's folding the skin. And one of the main therapies for this area of the face would be something like Botox, Dysport, Xeomin for relaxation of these muscles. By deactivating the muscle underneath the skin, we can then allow the skin to basically stay smooth rather than have lines being reinforced repeatedly. In some instances, if a line has been more deeply etched, we can first treat with a botulinum toxin to alleviate the muscle action, and once that's taken out of the equation, we can then add a filler to help bring that line closer to the surface and hopefully encounter that line and make it disappear. As for the lower half of the face, as we get older, there are two forces that create a more aged look. They include volume loss of the cheeks, and therefore fillers may be entertained, as well as accentuation of the lines between the nose and the mouth, as well as between the mouth and the jawline. These are all caused by volume loss of the cheek and therefore descent of the skin into these folded areas. Therefore, the fillers that we can often choose include Restylane and Juvederm. These can be used to either fill specifically the lines that we're starting to see, but in order to fundamentally counteract the volume loss of the cheeks, we may actually consider revolumizing the cheeks to lift the tissues and rotate them back up. For those of you who may wonder, injectable treatments can take anywhere from 15 minutes to 45 minutes here in our office, and oftentimes produce very little discomfort. And also, the great benefit is that there's little to no downtime, except for maybe a small risk of some bruising or some redness at the injection points, which may dissipate after 10 minutes. Thank you so much for watching, and we hope to see you again soon. Again, this is Dr. Deborah Pan from ESANA Plastic Surgery Center and Medical Spa. If you'd like to learn more, please visit our website at www.esanamedspa.com.